Listen, me news would like to introduce you to this brand new concept. One health, one Caribbean, one love. One health, one Caribbean, one love. Together we're strong, one health.
I'm Marcia Cameron, and I like to think of myself as a social advocate, specifically for nutrition in terms of improvements in nutrition. I have worked in the United States where I lived and began my family and did my first level of tertiary education for over 24 years. And I have worked in the capacity as a health and nutrition and family services coordinator, specifically coordinating services in those areas for low-income families so that families can access the services they need to improve their life experience with health and nutrition. I took this passion to the Caribbean about 5 years ago, where I decided to move back to my homeland, Grenada, because I really always had that urge and desire to return to Grenada and contribute to national development in the area of nutrition. So this is my way of giving back to my country. And in being here for the last 4.5 years, I have had an opportunity to really have some objective information in terms of objective data that points to the current nutritional situation in Grenada and by extension the region. And it is clearly an area that is being bombarded with a high prevalence of chronic disease. And chronic disease is clearly lifestyle related and preventable. Of course, you can have genetic predisposition, but if you have the right resources and access to the resources you need so that your lifestyle can be healthy, then you don't have to manifest any of these conditions. And so it has motivated me even more to be able to apply my knowledge and skills and expertise in this particular region to be able to improve the nutritional situation. One of the principles that guide my practice as a professional is always taking a holistic approach. I recognize health as a very complex issue or disease, if we want to put it that way, or the prevention of that. It's a very complex issue. And being a nutritionist, it's very clear that just that particular discipline is not adequate to really resolve the issues. They are much larger than just, nutrition. They're all of the different sectors that play a role in terms of really supporting this change to get a really better outcome with health have to play a role in this. And so I've always been an advocate, a supporter, and a believer in a holistic approach. And that was one of the things that actually drew me to the One Health project. The fact that One Health strives to create synergies between the different disciplines of animal, human, and the environmental impacts of health. And being specifically more in the area of human health, I have always had a huge interest in how all of these components actually impact the ultimate problems that we face in the Caribbean. Just in thinking about the environment, for example, we think about the way that food is grown and we think about how that impacts the health of the human being or the health of the animal. For example, when harsh chemical fertilizers and pesticides are used, it doesn't just affect the food, it also affects the human that's consuming the food and the animals that are also living in that and thriving in that environment. So there's clearly a need for synergy to be built and for this approach to be used and implemented in terms of improving the whole outcome of health in the Caribbean. The One Health, One Caribbean, One Love project aims to develop leaders in the Caribbean that can actually take this concept and implement it, develop it first on a national level and by extension on a regional level, and implement it in the region so as to achieve these outcomes. And this is an amazing opportunity. I'm really excited and I'm really pleased to be a part of it. It's really an amazing way to engage with persons in the field of medicine, whether it's animal, human, whether it's public health. It's a really good way to develop networks and to be able to, keep the communication going, the line of communication, so that there could be shared experiences and that we can learn together and hopefully practice together. So I am really, really pleased to be part of this. Now, part of the requirement of being in this leadership program is that, as teams, individual countries are required to develop a project of national scope. And I am one of a 2-member team for Grenada. My team member, Mr. Benedict Peters, is the other member, and we have decided to focus our national project on the issue of childhood obesity. We see this as a very urgent issue. We see this connected to the long-term economy, productivity, and health of Grenada. It is actually, if we look at the data points to a trend that is going upwards. The last survey that was done in 2014 for preschoolers showed an increase in children between the ages of 3 to 5 that were at risk for overweight, that were also overweight, and that were obese. So clearly this is something that we want to nip in the bud. What our project aims to do is really to increase awareness of that issue, in just reflecting on all of the different efforts that have been done in Grenada in particular in the past to address the issue of health, whether it was undernutrition or overnutrition, as we tend to categorize or refer to obesity and overweight. A lot of the issues is that they have not been able to be sustained. Whatever efforts have been made have not been able to be sustained, or they have not been successful. So we really had to look at that and really do a thorough sort of review of what has been done, what has failed, what has been successful, so that we can have our project address the gaps. We really didn't want to duplicate resources. We didn't want to duplicate efforts, and we didn't want to waste resources. So we really wanted to look at how can we be most effective with our limited resources and have the most impact. So we chose to channel our project on awareness, because in looking at the whole picture, we noticed that that's where the gap is, awareness. Oftentimes, the community, the beneficiaries are not aware that there is actually something happening that is supposed to impact them in a positive way. They don't really have input. It's kind of like decided for them, and they just kind of, they get whatever comes with that, but they have no say in it, and we have no knowledge of whether this approach is really the most effective way for the community. And so I think it must start with awareness. You must make the community, whether it's the immediate community, whether we're talking about the community of preschoolers, the community of educators, the community of parents, and by extension the larger community of the entire population of Grenada. We must start there. So what we've decided to do is engage a group of artists that can work along with us to champion this issue of childhood obesity and to bring awareness to the public through cultural expressions of music, right? The Grenadian populace responds positively to culture. I mean, we are a people that appreciate our culture, we appreciate our music, we move to it, and we really get the message through that. And so we thought, what better channel, to use than to have this expression of culture through music that can actually gauge the public and create this awareness. Along with that, we hope to have a few media interactions where we can have interviews with the artists, interviews with myself and the other team member, and to be able to spread the word. So, and media, by media we mean we're not limited. So we're looking at the television, the radio, the newspapers, social media, and just kind of creating this chain reaction where we can spread the word and get the message out there. So this is what the Grenada One Health Project seeks to do, to create awareness of the issue of childhood obesity, the urgency that we need to address this with. We cannot sit back. We're talking about the future leaders of Grenada. We're talking about the people that are going to make decisions about what happens in Grenada, that are going to protect and preserve this land for future generations. And if we don't put systems in place now to protect their health and to protect their productivity and ultimately impact the economy and health of the nation, then we're really heading down a wrong path. So this is what we hope to achieve with One Health. Now, in terms of the Caribbean and the future of the Caribbean, it's very hard to imagine what it's going to look like. Simply because I have stepped away from the Caribbean for literally over 2 decades. And in coming back, I have seen improvements. However, I'm very aware of the challenges that the Caribbean face. As a region, 2 of the major challenges that clearly impact change is human capacity and financial resources. And those 2 challenges are very real for the Caribbean. And therefore, change is something that actually becomes extremely gradual in the Caribbean, and probably not at the rate at which it needs to be. So it's in thinking of that and keeping those challenges in mind, it's really hard to imagine what the future would be like. However, I can say what I would like to see happen in the future. I would really like to see overall improvements in human, animal, and environmental health issues, right? And in order to achieve that, I'm talking more in the sense of having systems put in place. So for example, a surveillance system, right, that can monitor what's happening in terms of the issues that this region is most prone to as it relates to zoonotic diseases, for example. We're very prone to vector-borne diseases, having a surveillance system, having a system having laboratories that are well equipped so that we can diagnose what's happening, having the resources for treatment, an early warning system and tracking system that can prepare this region better to deal with the issues of vector-borne diseases, or even issues of the environment. I would love to also see improvements in food security, for example. With climate change, we know that food security is threatened, and we have a huge reliance on imports. I would love to see that reduced. I would love to see the food import bill be reduced and to have some of this money be channeled into production on a national level. But production that emphasizes, support for the environment, support for the ultimate consumer and the person the individuals that are going to be consuming this food. Agriculture that's not focused on mass production, but that's focused on the production of good, optimal products and produce that can be consumed, that is going to be good for the human body, right? And that's not going to be a threat. And I think one of the other things I would love to see is an increase in human professional capacity in the areas of health, so that we can actually have more power and more, we can be stronger in that area to be able to actually address this, because there is a limitation in terms of, specifically as it relates to nutrition, for example. Nutrition plays a critical role in this whole process. And, in Grenada, for example, there are limited professionals in that area. And I would imagine the other parts of the Caribbean by extension, I can't say for sure, but for Grenada, I know as a professional here that have been practicing for the last 5 years, I'm aware that we have a shortage. So I would love to see that, and more than anything, a coordinated intersectoral collaboration, that approach that we can't work in silos. We need to create synergies. We need to understand this this process and the relevance of it in moving forward, right? So in becoming a leader, in being, in having the opportunity now to be part of a 2-year leadership series, I think that my role is to ensure that I can develop myself fully in that capacity, but also, and to learn from others in that group, and also to be able to create that awareness. I feel it's my responsibility as a leader to be able to really develop that concept in a more, on a larger scale, and to be able to assist in the implementation of the concept and the aligned principles, So this is how I see, this is what I would like to see actually happening in the region in the future. I don't know in terms of timing how quickly these things can happen, but what I say, starting, you must start somewhere, and it really takes commitment. I think the political agendas have to be somewhat revised if they don't already cater for this. They need to be somewhat revised and modified to ensure that they are actually prioritizing this issue, because it's critical. Our food security, the whole relationship between zoonotic diseases and diseases of humans, and how the environment has an impact on that, and how the environment is impacted by that, is critical. It's really critical to a healthy future for the Caribbean.
One health is not just for people with medical occupation, it is for the entire population. So we need everyone cooperation across the region. Improve food security, better solid waste management and water purity. Protect the habitat for you and me, for the animals on the land and the fish in the sea. One Caribbean.